Akif! Hey, don't touch me.
Huh?
Do you know you have HFMD?
What is HFMD?
Do you guys know what is HFMD?
Hi, my name is Siti Nursifat binti Muhammad Hisham.
My name is Surul Aini Tibahan.
My name is Fardaja binti Ibrahim.
My name is Sadati Mardia binti Rasid.
My name is Muhammad Akif Haikal bin Muhammad Rizal.
And my name is Muhammad Zainal bin Zazwan.
Hi, Assalamualaikum warahmatullahi wabarakatuh. Welcome to our video on hand, foot and mouth disease or HFMD. This common viral illness primarily affects kids and young children, causing fever, mouth sores and a rash on hand and feet. Despite sounding intense, most kids recover within a week to 10 days. So I will share a little bit about recent data of HFMD. For the first 4 months of 2022, Malaysian had official report 47,209 cases of HFMD, a significant increase compared to 2,237 cases recorded in 2021 for the same period. Most cases involve children aged 6 and below. By May 2023, HFMD cases in Malaysia has exceeded the national alert level with numerous clusters reported across nurseries, kindergarten and child care centres. HFMD is primarily caused by Kawasaki virus S6 and it spread rapidly among young children due to their weaker immune system. When it might leave a rash or blister on your hand and feet, it is important to know that anyone can get HFMD. So the key is awareness and prevention. So let's stay tuned as we dive deeper into chronology, symptoms, causes, treatment and precaution to help protect our little ones from HFMD.
So, guys, do you know what are the symptoms of HFMD? So allow me to explain a few. So the first one is fever and general discomfort. So the first sign of HFMD is often a fever, typically between 38 to 39 degrees Celsius. This can be accompanied by general symptoms such as fatigue, body aches, irritability, and loss of appetite. Some children also have headaches and feel nauseous. So the second one is sore throat and painful swallowing. So shortly after the fever starts, children may develop a sore throat. This can make swallowing painful, leading to reduced food and water intake. So parents should watch signs of dehydration in their children such as dry lips, fewer wet diapers or dizziness. The third one is mouth sores and ulcers. So one of the most distinctive symptoms of HFMD is painful sores in the mouth. These small red spots quickly turn into ulcers and can appear on the tongue, inner cheek, gum and even the roof of the mouth. These can be very uncomfortable, making it difficult for the children to eat or drink. The fourth one, skin rash on hands, feet and other areas such as in the name of the disease, which is hand, foot and mouth disease. A day or two after the mouth sores appear, a rash develops. Small red spots or blisters appear on the palm of the hand, the soles of the feet and sometimes on the buttocks, knees and elbows. These rashes don't usually itch, but they can be tender to touch. So other possible symptoms are nausea, vomiting or mild diarrhea. So those are the main symptoms of HFMD. Thank you.
Alright, do you guys know how HFMD, hand, mouth and foot disease affect the other person? Which the first factors that affect the other person by direct contact, which touching the saliva, nasal discharge or fluid from blisters of an infected person would possibility have a high risk chance of getting HFMD. And after that, secondly, we have the respiratory droplets, which is coughing or sneezing. When the people surrounding us will get easily infected by HFMD. The third one is contaminated surfaces, which the touching objects that might get touched by the person who get HFMD will have the high risk of get the HFMD by the next person of touching it. And the fourth one is a fecal oral transmission. The virus is present in stool So, poor hand hygiene after using the toilet or changing diapers can spread it easily. And last of all, close contact, which is kissing, hugging, or sharing utensil with an infected person will increase the risk. It is most contagious during the first week of the illness, but it can still spread for weeks through stool. I guess that's all for me.
Some ways to treat HFMD include staying hydrated, managing pain, and maintaining good hygiene. Since mouth sores can make swallowing painful, it's important to drink plenty of cool fluids like water, milk, or electrolyte drinks to prevent dehydration. You can also avoid acidic and spicy foods as they can irritate the sores. Soft foods like yogurt, mashed potatoes, and oatmeal can be easier to eat. Good hygiene is crucial in preventing the virus from spreading. Hand, foot, and mouth disease is highly contagious, so be sure to wash hands frequently with soap and water, especially after using the restroom. Disinfect commonly touched surfaces such as toys, doorknobs, and tables to minimize the risk of spreading the virus to others. If your child is sick, keep them home from school or daycare until the fever is gone and any open blisters have healed. While HFMD usually cures up on its own within a week, it's important to monitor symptoms closely. If your child shows signs of severe dehydration, such as not urinating for several hours, dry lips, or has trouble swallowing or breathing, seek medical attention immediately. In rare cases, complications can occur, so it's always best to consult a doctor if symptoms seem severe or don't improve after a few days. Rest, hydration, and proper care will help ensure a smooth recovery. Most children recover quickly, and once they recover, their immune system becomes stronger. By following these simple treatment steps and taking precaution, you can help managing HFMD effectively and prevent its spread to others.
One often mistaken as a common childhood illness, the rapid spread and recurring outbreaks of HFMD in recent years have raised alarm among health experts and parents alike. Okay. So, let's explore the timeline of HFMD in Malaysia. In 1997, first Malaysia HFMD outbreak occurred in East Malaysia. In 1997, before it was spread to the Peninsular Malaysia, we recorded 4,253 cases with 41 deaths, mainly in Sarawak. It was linked to entovirus 17.1, EV71, which caused severe neurological complications and fatalities. Malaysia was again troubled by a deadly HFMD epidemic, then followed by 3 yearly large outbreaks in 2003, 2006 and 2009 in the East Malaysia. In 2012, high incident rates. The number of HFMD cases exceed 34,000. The disease continues spreading, but mortality rates remain low due to the better medical response. In 2018, Malaysia recorded over 15,500 cases between January and June. Selangor, Kuala Lumpur and Putrajaya were the most affected areas. Many children's centres and kindergartens were temporarily closed to curb the spread. Data from Ministry of Health Malaysia in 2018 report 76,446 HFMD cases. Outbreaks nationwide significantly differ from 2017, which was 29,358 cases. In 2022, after the COVID-19 movement, restrictions were lifted, HFMD cases spiked dramatically. In the first 5 months alone, Malaysia recorded over 96,000 cases, a 15-fold increase compared to the previous year. The MOH intensified hygiene awareness campaigns and public health intervention. While in 2023, the MOH report ongoing cases but at a lower rate than in 2022. Public health measures, including sanitization in child care centres, remain crucial in controlling outbreaks.
In conclusion, HFMD is a common yet highly dangerous viral infection that primarily affects young children. While it usually mild, it can spread quickly in schools and daycare centres, making prevention crucial. Simple measures like regular hand washing, sanitizing shared surfaces, and isolating infected individuals can significantly reduce the spread. If symptoms arise, yearly detection and proper care can ensure smooth recovery. Let's all do our part in maintaining good hygiene and protecting our loved one from HFMD. Stay safe, everyone.
My name is Siti. Muhammad Hisham. My name is Lauren. Kamu dah